Assalamu alaikum. My name is Dr.Muneer Faswala. I am a diplomat American Board of Internal Medicine, diplomat American Board of Geriatrics, fellow American Board of Hematology, Oncology and Disabilities. Prior to that, I was an eye surgeon in Edinburgh. I am speaking on infectious diseases. Infectious disease is a rising part of the whole planet. Now we came across a very horrible COVID, which is in season doesn't stop, keeps on continuing with its own momentum and all its variants, and cause a huge amount of death and morbidity. People don't realize that apart from the death, the lung is wiped out, the heart is damaged, and years down the line we will see the consequences coming. Now there are other horror viruses on the horizon and they're roaming around and can cause bigger catastrophes. Other than that, as part of the third world, we have tuberculosis to worry about, and drug-resistant tuberculosis is a rising problem. And there is also a kind of a drug-resistant tuberculosis which is not responding to anything. Another thing is Acinetobacter, and India was really clubbed on that because of medical tourism, and a few American patients died because of drug-resistant Acinetobacter, which will not respond to any antibiotic. Now we got malaria, and malaria is a big problem in our part of the world. Typhoid fever. Typhoid fever is extremely resistant now, and now we have to use very high level of antibiotics because now conventional antibiotics like ceftriaxone, azithromycin do not work. Other than that, we have a lot of other problems. We have got a huge parasite population. In the third world, most common cause of anemia in women and children are parasites. That is why in the schooling system now they are giving antihelminthics to kill the parasites. There is like these parasites like Necator americanus, Strongylodis, Trocholis. They are a very big part of iron deficiency anemia. And there is a B12 anemia too, which is called megaloblastic anemia, where the people use methylcobalamin, and there is a worm by the name of Diphyllobothrium latum, which eats away the vitamin B12. It is an extremely big problem and ongoing problem. Now a lot of other variants of diseases are coming around, like in the animal there is brucellosis, and even doctors don't understand what brucellosis is. It's transmitted from animals to humans and it causes arthritis, heart damage. Now Lyme disease is very famous, especially in the West. It is borne by ticks, Borrelia burgdorferi, and this tick bite can cause myocarditis. There is myocarditis inflammation of the heart. It can cause joint damage, neurological problems, and palsies. So this is infectious disease is an extremely important topic. Now in the cases of ICU, there are ventilator-associated pneumonias, there are MRSs, there is VRE, and vancomycin-resistant enterococcus. Extremely huge amount of plethora of bugs which are not responding to antibiotics. And because these older people, I'm a geriatrician too, so older people have limited resources in their body. Now the bigger amount of antibiotics we use, the more vulnerable to it, and the more episodes of organ failure will happen. So this has to be reckoned with, and especially we have to have ID committees in every hospital, stop the spread of resistant bugs, and the resistant bugs spreading from patient to patient. Like suppose it affects a ventilator patient, it becomes extremely difficult to treat them. And broad range of antibiotics which we use compound kidney failure, liver failure, heart failure, electrolyte balances, and urine output. All these things are affected.